All right. Hi, everyone. We're so excited to have you here today in a continuation of our Pollie webinar series. As part of this series, we're speaking with leading practitioners to tell you everything you need to know about managing your hormonal health. My name is Stephanie. I work on educational content at Pollie, and I'm here today with Dr. Pooja. Dr. Pooja is a leading functional nutritionist focused specifically on hormonal health. And the focus of today's webinar will be on managing PCOS through nutrition. Also here today are Pollie's co-founders, Jane and Sabrina, who will guide us through the discussion. Hi, Jane and Sabrina.
Hi, everyone. Thank you for joining.
All right, well, Jane and Sabrina, I'll let you kick it off with questions for Dr. Pooja. We'll go through some of our pre-planned questions, and then we'll pause at the end for some of the questions that we've collected from our community.
Awesome. So I will kick it off, and we'll be going through some slides today. So let me just grab those. And while I'm doing this, Dr. Pooja, do you mind just giving an introduction on yourself, your practice, what drew you to women's health?
I would love to. Hi, everyone. I'm Dr. Pooja, and as Stephanie mentioned, I am a functional nutritionist, and I have a virtual private practice that specializes in gut, immune, and hormonal health. And my kind of entry or gateway into this whole world, I always say that it was a little bit accidental because I actually started out as a pharmacist, and I worked as a pharmacist for about 6 years. And through that time, I actually ended up having my own set of hormonal issues and gut issues and liver issues, and I was a little bit of a hot mess. And at that time, I was taking medication for my respective conditions, and I did see a little bit of improvement, but not enough. Not enough for me to say, okay, I'm going to stay on these medications long term. So, and I could really put my kind of investigative hat back on, which I'm grateful for having that training in pharmacy and going through pharmacy school, because that's kind of what we were taught all throughout, is to dig through the research materials and to find answers and to dig deep into the different mechanisms of your body and so forth. So I kind of put that hat back on, and I really just went into the research. I read all these different books, and eventually I was diagnosed actually with PCOS and non-alcoholic fatty liver disease and IBS. And at that point, I knew having a name to my symptoms really helped, because I was able to kind of direct where I was doing my research now. So that's kind of where my journey started. It was first fixing myself, and then once I finally was able to come to a much better place, it felt like I was like, oh my gosh, how come no one else is talking about this? And I feel really grateful and fortunate that around that same time, I found the field of functional medicine, and it was kind of this beautiful, I kind of just stayed at the stars aligned, and I went ahead and went back to school and got my master's in nutrition and functional medicine, and then I got further training from the Institute for Functional Medicine. And now I can take everything that I've learned personally by working on myself, and then all of the other training that I've received, and I can help other women. So it's really been a magical ride. There have been many ups and downs along the way, as it comes to being a small business owner, but I don't think I would trade it for the world.
Amazing. No, that was super, super amazing to know your story. I have PCOS myself. I know that working with people that have, and women like yourselves that have been through it, is just so much more helpful, I think, from a client perspective. And a lot of what draws people to functional medicine is dealing with a hormonal imbalance or some other sort of mystery illness, where you really, really do need to take a functional approach to looking at things. So that's really love that your own story brought you to this. And so would love to chat a little bit more about nutrition credentials. I know that you're a CNS and an LDN, and did I say that right?
Yeah, CNS and LDN.
Yeah.
I'll explain what that means.
So would love to know what that means, and just kind of like the difference between those certifications, which are board certified, and then something that's more like a functional medicine certificate, and just how that kind of, what each credential brings to your scope and how you can work with clients.
Yeah, okay, I think this is such an important question because obviously this field is exploding, which is a good thing, just as we're getting more into personalized medicine and just a general understanding that, you know, what we eat actually impacts our health. So all of this kind of knowledge is expanding, and so there's this demand for nutrition, and so this field really is exploding. But and with that comes like the different certifications that you kind of touched on and credentials, which I think is great because there are now more professionals that are more equipped to help with the chronic disease population than ever before. So I think that I want to touch on RD first, like registered dietitian. That's probably the one that most people are familiar with. And then I'll go into CNS, which is certified nutrition specialist, and health coaching. There are like a few other credentials that I've come across. There's one called CCN, I believe that's certified clinical nutritionist, and NTP, nutritional therapy practitioner. But I'll focus on the other ones a little bit more today just because they're more common. So RD, or stands for registered dietitian, and this is, I pulled this kind of directly from the American Dietetic Association's website. So an RD is a food and dietary professional. They usually have 4 years in training, like a bachelor's degree, and then they typically have somewhere around 900 to 1,200 hours of a didactic internship. And they have to pass a didactic registration exam. CNS is another, highly qualified nutrition professional. They have to have an advanced degree. So they have to have either a master's or a doctorate in nutrition from an accredited university, along with 1,000 hours in supervised training, and then also passing the board exam. And then health coaching, which there are so many programs out there. And again, I think that their role is really critical and just really helpful in a healthcare setting. But their role is a little bit more, I would say, supportive in nature. So I would say that a health coach is someone who's like a supportive mentor, and they can really help clients overcome any barriers that may be in the way from them achieving, a positive diet and lifestyle change. So typically I feel that health coaches, absolutely they can work independently, but I do see them more often working in a supportive role, like within a functional medicine practice where there's multiple, where there's complementary roles. So the health coach being one of them. So I do tend to see health coaches playing that supportive role more often. And one other thing is so in terms of scope, so as this field is exploding, there are a lot more laws and regulations that are now changing across the states. So sometimes it's a little bit challenging, even for me to keep up with, or even a lawyer, I would imagine, to keep up with. So there's several states where only a registered dietitian can offer services where I would not be eligible to provide my services. And then there's other states across the country where all nutrition professionals can offer their services, but only an RD or a CNS can offer what's called medical nutrition therapy. And this is a service that entails addressing chronic conditions through the use of a personalized nutrition plan. So now many states have also started passing these licensing laws. So whether you're an RD or a CNS, you have to apply for this licensure, which legally gives you the permission to perform medical nutrition therapy, which is just a big fancy phrase for, if you have a chronic illness, a nutrition professional, an RD or a CNS will be able to help run labs, recommend a personalized diet, recommend personalized supplements to really help you, whether it's to go into remission or whether it's to balance your hormones, whatever that medical condition or chronic condition may be. Now, with that said, though, no nutrition professional, regardless of where you live in this country, can give you a diagnosis. So if you are still in a position where you have a set of symptoms, but you still don't necessarily have a name tied to it, like you don't have a diagnosis, then it's really important for you to seek that medical care first, receive the diagnosis, which could be, through an MD, like a medical doctor, or even a naturopathic doctor in some states. And then once you receive that diagnosis, you would then go to a nutritionist that is more functionally oriented and can help you through the various diagnoses that you've received. So like for example, my clients, they typically come to me already knowing that they have PCOS, knowing that they have Hashimoto's, ulcerative colitis, endometriosis, and then they're looking for alternative therapies outside of medication and outside of surgery, let's say.
Yeah.
So, yeah.
That is, I mean, that's just such super helpful information to know. And I think that particularly from the consumer perspective, it is just so convoluted and confusing to know, like, how do I even get a diagnosis? Do I have a diagnosis? Who do I work with? I know that with my PCOS, was diagnosed with an OBGYN and then worked with a naturopathic doctor and a functional nutritionist to help actually manage things. And it's something that we're trying to do with Pollie, is just make that process more streamlined and more transparent. But I think that just super helpful for people to understand all of that. So thank you for the context. And especially with if you want to be submitting claims for reimbursement, or if you're looking for someone that's in network, it's important to, in lots of states at least, to make sure you're looking for that RD or a CNS credential, it seems like. So definitely good information for people to have.
Yeah, and I'm grateful for you guys because you have created this amazing platform that connects providers and practitioners to women that are seeking this care, which I think is so needed. And it's amazing that you guys you're putting together something that can bridge this gap.
Well, thank you so much. No, yeah, we're super passionate about it and excited to do that, but it's good to hear from you that you are too. So pivoting a bit now, you had mentioned that you have PCOS. I have PCOS. It's one of my favorite things to talk about, but would love to kind of turn the conversation a little bit to that. So like, we'll start off just super basic, and for our listeners who may have recently received a diagnosis and don't really know what that means, or for people who have no idea what PCOS is, what is it? And just give a high level overview for people who might be new to the world of hormonal health.
Yeah, absolutely. Yeah. So this is one of my passion areas, equally as Jane, you mentioned. So PCOS stands for polycystic ovarian syndrome, which I think is a bit of a misnomer, and I'll get to that, but that's what it stands for. And it's actually the most common endocrine disorder affecting women today. So it's like affects 1 in 10 women of childbearing age. And I think this is pretty significant. So yeah, rightfully, I feel like it deserves all the attention that it can get. But I think in order for me to explain what PCOS is, it's actually easier for me to talk about the diagnostic criteria, because again, like I mentioned, from the name alone, it is a little bit of a misnomer. So in order to receive the diagnosis of PCOS, you have to meet 2 out of 3 criteria. The first one is absent or irregular periods. The second one is what's called hyperandrogenism, or excess male hormones. One example of that is testosterone. And then number 3 would be multiple cysts on ovaries, which can be discovered on ultrasound. So again, and I think this is a pretty big myth, is that you do not necessarily need to have cysts on your ovaries in order to have the diagnosis of PCOS. So as long as you have elevated androgens and absent or irregular periods, you meet that criteria. So I think that there's a lot of conversation going on in the medical space, like leading endocrinologists and gynecologists that are putting together guidelines for PCOS when they meet, let's say every few years. This conversation has come up, like, do we want to change the name of this condition? So that's what PCOS is in a nutshell. And then, so some symptoms or signs to look out for PCOS, again, absent or irregular periods, difficulty getting pregnant if you're trying. And again, that's because if you already have irregular periods or absent periods to begin with, then infertility is can be a big component of that. Excessive hair growth, which is also, like, medically it's termed hirsutism, and this usually shows up on your face, your chest, your back, and then not only do we get hair growth in unwanted places, but then we lose our hair where we have our hair and we want to keep it. So thinning of hair or hair loss from the head, this is a very unfortunate situation. Weight gain, and then oily skin, acne. So those are some of the most common signs and symptoms of PCOS. And then, Yeah.
That's super helpful. And can you explain a little bit about what insulin resistance is also? And I know it doesn't affect everyone, every woman or person with ovaries with PCOS, but just what it is, how many women generally it affects that has PCOS, and can go from there.
Yeah, absolutely. So I was going to like continue talking, and it was just a run-on thought that I had was, okay, I need to want to touch on insulin resistance, and the reason for that is because so there's different mechanisms within your body that can take place that can lead to PCOS. So insulin resistance is one of those mechanisms, and it's the most common mechanism. I would say, and don't quote me on this, but I would say roughly like somewhere between like 60 to 80% of cases are like insulin resistance related. So what exactly is insulin resistance? So this is a kind of a physiological mechanism that occurs whenever a woman with insulin-resistant PCOS were to eat carbohydrates, let's say, any form of carbohydrates, that carbohydrate will turn into sugar in our body. And then that sugar, in turn, will have a very difficult time entering the cells. And the reason for that is because it's kind of, I think of it kind of as a lock and key mechanism. And insulin is the key that allows glucose to drive through into the cell. So when we don't have that key, or when that key is, let's say, in very little quantity, it causes glucose to build up outside of the cell, and that in turn causes all the other kind of pathophysiology of PCOS. So that excess glucose can then kind of ping the ovaries to release more testosterone. It can be taken up by the liver and cause fatty liver disease and so forth. So that's kind of what the premise is of insulin resistance.
Yeah, no, that's super helpful. And I think a great transition into the next topic, which is nutrition tips for PCOS and how to manage symptoms through food. And so this is really your bread and butter. I mean, like, this is what you focus on with your business. So I'll let you take it from here. But I guess just like in terms of when a client comes in, I mean, is there a difference in like types of PCOS that they may have? Like if they have insulin resistant PCOS versus non-insulin resistant PCOS, how do you even know how to like start changing your dietary habits and stuff? I'll give you the stage.
Okay, so let me actually talk about the different subtypes first, and then we'll do a deep dive into nutrition. So we already talked about insulin-resistant PCOS. That's the main one, or that's the most common one, rather, I should say. And then there are three other subsets. So the second one I would say is adrenal PCOS, where this person does not have insulin resistance. In fact, their blood sugar chemistry is completely normal, but they still have an elevated adrenal hormones, one of which DHEAS is an androgen. So, and that's coming out of your adrenals. So when blood work shows that they have elevated DHEAS, that qualifies them to have this diagnosis of adrenal PCOS, assuming that, yes, they have irregular periods and they, meet the other criteria. So that's the other subtype. And then we also have post-pill PCOS, which occurs when someone were to come off of birth control. Specifically, there are, I would say, select birth control that cause a really extreme androgen rebound effect, meaning they come off of this birth control, and now all of a sudden their androgens kind of go haywire, and it puts them in this kind of temporary PCOS state, and that is known as post-pill PCOS. And then lastly, there's inflammatory PCOS, which I would actually go ahead and say that inflammation is an underlying factor in all of these. But there's particularly this one condition, or this one subtype rather, that can really there's enough inflammation in the body that can drive your androgen levels up. And that's outside of blood sugar imbalances or insulin resistance. So knowing that there's at least 4 subtypes of PCOS, nutrition ends up being a really important aspect of care. And so whenever I meet with someone for the first time, I always want to know what they've already tried, and I want to know what it is that they're willing to do, because I want to make sure that I meet them where they're at. And even if they're, if perhaps they're unwilling in the beginning, I think if we were to take baby steps to ultimately get to where we need to be, that I've found to be much more effective than just saying, okay, you need to do this, and this is the only approach, this is the only way to do it, and this has to happen overnight. Certainly not the case, and I think completely unrealistic. If I were to touch on my own story, it took me like 2 years to make these changes, because I would keep trial and erroring and finding new foods in the grocery stores, and there was like all these cool new vegan products, and part of the PCOS nutrition plan is to go dairy free. So it's just, I kind of want to say that before I dive into the detail, like, you can take your time. It doesn't have to happen overnight. But in terms of the actual plan itself, I really am a strong advocate for an anti-inflammatory plan. So number one, organic when possible, because a lot of this conventional produce is just loaded with pesticides, and all of these pesticides act as endocrine disruptors, and that can worsen your hormonal imbalance. We want to aim for low glycemic, because of course, so much of PCOS is related to blood sugar balance. So we want to make sure we're eating foods that are not going to spike our blood sugar as much. So we just want to eliminate any of these refined grains, sugars, stick to minimally processed sugars like raw honey in small amounts. And then when I say refined, that includes like table sugar, but that also includes your refined carbohydrates that are really going to spike your blood sugar, like pastries and white bread and pizza and bagels and like all the good stuff. Yeah. And then anti-inflammatory, another component of this umbrella are, consuming lots of vegetables along the rainbow spectrum of vegetables. You want to aim for like 6 to 9 cups a day, which sounds like a lot in the beginning, but I think there are kind of tips and tricks that we can use to sneak those vegetables in through the different meals during the day. And like making smoothies in the morning, I think automatically you can throw in like 2 or 3 cups right there, and that's like a really great way to get in your veggies. Removing gluten and dairy from your diet, and the reason for that is because these are pretty inflammatory foods. And specifically with dairy, there is a hormone in dairy called insulin-like growth factor 1, or IGF-1, that essentially mimics insulin. So if you have insulin-resistant PCOS and all of a sudden you're eating a food that can add more insulin to your body, that's going to make the blood sugar imbalance even more imbalanced. So yeah, so you want to remove the food that's triggering that. And then using anti-inflammatory cooking oils like ghee, coconut oil, palm oil, olive oil, flaxseed oil, and so forth. We just want to stay away from things like corn, canola, and soybean, because again, that's going to drive the underlying inflammation. Avoiding fried foods, and I think this might be one of the most important pieces, is we want to add protein to every meal. And this would be beans and legumes, eggs, animal protein, whatever your preference is, but protein's essentially going to dampen that insulin response in your body. So it kind of balances out the different carbohydrates that you're eating throughout the day.
Yeah, absolutely. No, I know that myself, when I don't eat protein in a meal, I turn into a psycho after, because I get the blood sugar dip, and it's just a disaster. Do you do any sort of like food sensitivity testing with your clients, or like are there cases where like maybe one woman might be able to handle high fiber fruit or fruit in general, and another woman cannot even really tolerate like raspberries and strawberries for blood sugar control? How do you like figure out those sorts of differences between different people?
Yeah, so first we always start with, so actually I will say this much, I do request like a fasting glucose and a fasting insulin from everyone that I work with in the beginning, just because I want to know what their baseline is. Absolutely. And then I will, we'll go ahead and incorporate these changes slowly. Again, I want to make sure that we're doing it at a pace that they're comfortable with. And periodically we may continue to check fasting glucose and fasting insulin just to make sure that we're hitting the right number. But then let's say this client has made all of these changes and they've definitely seen an improvement, but it's not where we need them to be. That at that point, I would start to consider like blood sugar supplements that can really help support if they're in a really bad insulin resistant state. These supplements can go ahead and aid them a little bit further along that journey. And then if for some reason that's not working either, or that's not enough, then we'll go into other aspects of like food sensitivity testing, like you had mentioned. So yes, I do incorporate that. Then we'll also look at like their thyroid, we'll look at their adrenal status and other aspects of their health that may be preventing their blood sugar from normalizing.
Awesome. No, that's super helpful. And this is a little bit of a tangent question that just popped up. But in terms of insulin resistance, I've heard that your blood sugar can be normal, but you can still be insulin resistant. Is that true? How could that kind of show up in a blood test if you have like normal blood sugar but still having insulin issues?
Yes, that is 100% true. And the reason that happens is because your blood sugar or like your glucose number is like the last thing to change on a lab. So
Wow.
it's interesting that most of healthcare just looks at fasting glucose and your A1C. But believe it or not, those are the last numbers to change. And so someone can already be insulin resistant, and that number and that state of insulin resistance won't reflect on a normal traditional blood panel. So I always add in like fasting insulin because that's one of the earliest markers for blood for blood sugar changes, which can indicate insulin resistance. So if your fasting insulin oh my gosh, if your fasting insulin number is greater than 5, then we're already kind of going down that road of insulin resistance, and that's when we need to take all these precautions to avoid it from creeping up even more. And your blood sugar can still look normal in that state. So important to check different markers.
Yeah, no, that's super helpful to know. And I don't have insulin resistant PCOS. I have the adrenal type, and also had post-pill type at one point. But anyway, when I was trying to get a diagnosis, I remember that they wouldn't test my fasting insulin. And it was just a big problem, and ultimately ended up getting it done, and it wasn't a problem. But I do think it's just so important that people know what sorts of markers they should be looking for with their tests.
Absolutely. I think in like this day and age, but there's a lot more information that's readily available, and you have to be your own best advocate. Like you have to push to get some of these markers done, just because traditionally they're not done. But as more and more people push for it, I think it takes time to create systematic change. But it just starts with you having to advocate for yourself.
Absolutely. Awesome. So that was really, really helpful. And we'll kind of close this part of the talk out with the connection between gut health, immune health, and hormonal health. I know this is a really, really big theme of what you focus on at your practice. You did an excellent blog post for us a few months ago that I'll link to in the YouTube notes for everyone that hasn't listened or read it. But would love to just kind of hear a little bit about how your gut health might be impacting your hormones, why you might be at a bigger risk of autoimmune issues if you have gut issues or if your hormones are imbalanced, etc. And just why it's important to really take a view of all of these bodily systems and functions and stuff when you're trying to figure symptoms out.
So this is my favorite topic. I'm obsessed with it because I think that we don't talk enough about how interconnected these body systems are. And I think a big part of that is because just as we've been kind of conditioned through conventional healthcare that everything is in silos. Like we go see a gastroenterologist for our gut problems, an immunologist for maybe our immune system problems, and a gynecologist or endocrinologist for our hormones. But in reality, these body systems are all completely interconnected. And it wasn't for me until I discovered functional medicine that I learned, okay, wow, there's so much research that does show this, that the interconnectedness of it all. So I think the best way for me to explain this is if I just go ahead and share a few examples of how these systems are actually connected.
Absolutely.
Yeah. So the first one I want to touch on is like gut and immune and how they're connected, and an example of that. So there is a physiological phenomenon called leaky gut, which more appropriately is known as intestinal barrier permeability. And this can cause pretty much any macromolecule. So it could be like a larger food particle that didn't get broken down, or toxins, or undesirable pathogens, or microbes. And all of these can, when you have this phenomenon of leaky gut, they can pass through our gut lining. And after enough of an exposure, our immune system finally gets primed and it begins to react. So once your immune system has picked up on, let's say you react to gluten and you've been eating it all your life, and then now you reach a certain age and all of a sudden your immune system starts reacting to it because it had all those years of exposure for the immune system to kind of get primed, and now it's actually reacting. And that reaction manifests into long-term inflammation, which can be over the course of a few months to years, but then this can ultimately translate into a chronic illness, like think autoimmune, allergies, asthma, even obesity. So I always, when I'm working with a client, gut health is really, really important. And one of my go-to tests would be like a microbiome test, so we can check out what's going on, what the state of their microbiome is, and then do they have intestinal permeability. And then, yeah.
Not cool, but good knowledge. Yeah.
I think it's cool that science is uncovering all this, right? And we're
that's very true.
To things that for a long time, we're like, oh, we don't know why this happens, but now we do.
Yeah, that's incredible.
Yeah. And then I want to also maybe share one more example on gut and hormones and how they're related. So I'm going to go into the example of estrogen. Okay. So when estrogen is getting ready to leave the body, it has to first go to the liver, and I say that it gets tagged for clearance. So from the liver, the tagged estrogen then makes its way into our GI tract and eventually our stool or colon for elimination. Mm-hmm. But interestingly, there is an enzyme that is produced by our gut bacteria, and this enzyme is called beta-glucuronidase. And it's responsible for removing this tag from estrogen, which allows the molecule to re-enter circulation. And this process happens like naturally in every woman, but it becomes problematic when this enzyme, beta-glucuronidase, reaches high levels in the gut. And then this causes more and more estrogen to then recirculate in the body instead of it getting cleared out. So this excess estrogen can then go on to cause all sorts of hormonal symptoms like mood changes, PMS, fibroids, ovarian cysts, even has been linked to like endometriosis, hormone-dependent cancers, and so forth. So I just think like through these two examples, it can showcase how connected they really are. And in order to get to the root cause of any symptom, whether your primary condition or symptom is gut-based, immune-based, or hormone-based, it's important that we evaluate all three body systems to get to the bottom of it.
Yeah, absolutely. And I think that, thank God more awareness is building about taking an approach like that, but it really just is incredible. I know for myself, like my gut and hormone imbalance symptoms are so correlated. And if I start having gut issues, a few months later, I'll have like a PCOS flare. And it's really just incredible to kind of watch it in action.
Absolutely. I've been there, right? Yeah, I've been right there where I've been married now for 6 years, but when we first got married, we took a bunch of international trips, and I definitely picked up a couple like nasty pathogens, like a parasite. And that was the root. Like a year later, when I finally did my first GI map test on myself, I figured out that was worsening all of my PCOS symptoms. It was causing acne when I never, that wasn't an issue for so many years, and all of a sudden it was happening again. So it's just so interesting when you run some of these things on yourself and you realize, wow, the research is spot on. Yeah.
Wow, that's wild. Awesome. So this is it for the webinar portion, but we do have a little Q&A section that we're going to jump into, and Sabrina is going to take over that. So I will stop sharing my screen.
Yeah, fantastic. Dr. Pooja, thanks so much for all of that. It was so interesting, and I feel like everyone who watches this is just going to learn a lot. So appreciate that. We have a few questions that came in from our community, so I'll just start. This will be pretty quick, but I think some of the stuff we've already touched on actually, but still good to kind of go through and repeat those things. So the first question is, do I need to eat a keto diet for PCOS? And so if you just want to comment kind of on that, again, I think you've touched on a little bit of that, but keto specifically, any thoughts there?
So in terms of keto diet, I am an advocate for it, but I don't necessarily believe that that's the first step. I don't think that we need to go all the way to a keto diet in order to see changes in, let's say, your blood sugar numbers or even your PCOS symptoms. So I always say, let's start with a balanced approach. Let's start with an anti-inflammatory approach, because I strongly believe that carbohydrates are still very much an important piece of your diet. In fact, it helps with controlling your mood and your appetite, and there's so many aspects to it. So removing it completely from your diet, I feel like, is also, if we don't need to go there, I'd rather not. Yeah. So I'm a more of a fan of just, let's take the most balanced approach that we can, and then let's analyze, let's take a look at your test results again and see if we need to go into something that's a little bit more restrictive in nature.
Yeah, so definitely more of a personalized approach, not a one size fits all. So the next question that we have, which again, I think you touched on, but would love to kind of go back to it, is someone who said they have a few symptoms that seem aligned with PCOS. So some acne, excessive hair growth, they have had ovarian cysts. And this person's wondering if it's possible that they have PCOS and what they would need to do to get a diagnosis. So it's not something, it sounds like, that's come up before with their doctor. What should their next steps be there to see if they might have PCOS?
I think that's a really great question, because we kind of touched on this earlier, but there are so many providers and there's so many practitioners, and we all have our own specialties. But in order to receive a diagnosis, if you really do believe your symptoms align with this condition, then the most important next step for you is to go see a medical doctor or a naturopathic doctor, someone in your state or in your area that's able to actually provide you with a diagnosis. It's super, super critical. And then if you're welcome to continue working with that individual for the actual care or the treatment aspect, or at that point, there are so many alternative supporting approaches that you can also take. So if you wanted to go into more of a nutrition or functional medicine approach, there's tons of practitioners that can help you with that. Certainly even acupuncture has been shown to help with PCOS. So I just feel like there's so many different modalities once you receive that diagnosis, but the key is to actually receive that diagnosis, because this could actually mimic, even though it may seem like PCOS, it could be something completely different.
Yeah, that makes a lot of sense. And I think it's definitely great advice for people out there who aren't sure what's going on, to next steps for them. And so the next question we have is, if I'm on medication for my PCOS, should I still try and make lifestyle changes? And so do you have any kind of comments around that, or specific thoughts?
Yes. So, so my background is actually as a pharmacist. So I do have that in-depth kind of knowledge on how these, which drugs are most effective for hormonal health, which ones, how they work and what are their side effects. So gratefully having that information, I advocate that you are your own best advocate. So you need to make sure that if you're taking medication, that is the approach that you're most comfortable with. But if the question is, can I still be on medication while making lifestyle changes? Absolutely. Your lifestyle changes are not going to necessarily affect like the efficacy of the drug. I think it's a little bit of a different question if, can I use supplementation and lifestyle instead of medication? I think the answer to that might be slightly different. From my personal experience, yes. I've seen a pretty profound change in my own health once I eventually stopped taking metformin, eventually stopped taking birth control and spironolactone, and I turned to first changing my diet and then adding on a few supplements that worked in a similar manner. And that's what really improved my numbers. But I think it's important for you to have that type of conversation with your healthcare provider to see if it's worthwhile for you to come off of medication, or to at least add in these different nutritional and lifestyle strategies along with the medication you're taking.
Yeah. I think, I mean, again, it just points to kind of the personalization piece here of being so important for each individual, of kind of what the right thing is for them. Mm-hmm. Any other questions, Jane or Stephanie, that we've gotten in?
I have one additional question that just came up from the last two you asked. You know, I know that going the traditional route, seeing traditional healthcare providers is so critical to getting a diagnosis. But I'm curious about, you know, some of the ways in which your patients that you've seen have been frustrated with that traditional process, and where you think some of the naturopathic and other sort of alternative providers can really play a role in supporting those patients.
Yeah, so I feel that this is more common than even I would like, the frustration. It's something that a lot of my clients will say, okay, well, this is kind of my last effort because I have this condition and the only next step for me is surgery. So I want to do everything in my power to avoid surgery. Or I have an autoimmune client who already has a diagnosis of ulcerative colitis and currently in a flare state. And, you know, conventional approach at the moment is, okay, take this long-term medication, but then you can take steroids for these flares, and there's acute situations. And I think the goal for her is, okay, well, I don't want to always lean into steroids because that they come with their own set of side effects if they're taken long-term. So it's, well, what else can I do? What else can I do to change how do I improve my body system so these flares, if I can stop them from happening or minimize them from happening, or if they do happen, then maybe they last just a day or two and not weeks and weeks at a time. So I think everyone kind of comes in with a different goal in mind, but kind of share the same frustrations as well. This is my only other option, so I want to see what can I do otherwise.
That's super helpful. I think it's just great and inspiring to know that there are so many other ways to manage your health and improve your condition versus just the traditional route.
Yeah, absolutely.
Well, thank you so much, Dr. Pooja. I know this was hugely informative for me and the team on the line and our community watching everywhere in the world. We're so grateful to your time, and this has been really wonderful just to listen to you.
Well, thank you so much for having me. I am so grateful to be part of the Pollie provider community and just to be able to offer any insight that I've learned along the way. So
thank you so much, Dr. Pooja.